My worst experience in school was when Mrs. Nyako knocked me. Hey, in the dining.
What did you do? Did you smuggle?
No.
You're very disciplined. I pulled out the big guns as promised. So I brought Dr. Vanessa. She's the Dr. Vanessa, the Hobson, the medical inductee, youngest of her session, board member of Eve, owner, founder, etc., etc. You know, she'll give you all the juicy deets on her life. And so with me is Dr. Vanessa Atikpui. Don't kill me for murdering the name.
You actually pronounced it quite perfectly. Thank you.
But first, before we get to motherhood, because I mean, like, there's so many things before we get there. Let's talk about your journey as a medical doctor so far. Let's talk about the health space in Ghana. What even made you want to start First Aid on Wheels to begin with?
I drew inspiration a lot from my dad. It was more of a nature. I started school quite early, and my dad nurtured me into where I'm at today. Healthcare in Ghana, I would say there is a lot of room for improvement. I believe that we still have a long way to go. I would compare today to maybe 10 years ago when I started active practice as a medical doctor. There's been quite an improvement, but we still have a lot of work that needs to be done. When we look at our health systems, we don't have the resources to match the expertise that we have in the country. There's a lot of brain drain simply because people are moving away to preserve their peace of mind, their mental health, and then also to be able to afford the lifestyle that they desire, the basic needs to sustain us as an individual. So the brain drain is significant because we have the knowledge, but then they're moving away because it's exhausting, it's overwhelming to actively work here, especially in the public sector where the doctor to patient ratio, the gap there is on another level. And then the resources.
Right.
The resources are not matching the work that we know how to do. I moved from the public sector into the private sector simply because of that.
How's that going?
Very well, actually. I would say I'm privileged with where I'm at currently because it allows me to practice medicine like I know how to.
Okay.
Practice medicine like I've been taught to.
That's
the
very
resources,
important.
Yes.
I feel like if I walk into the hospital, even if I have a common cold, it's as important as the person who's having diarrhea.
Who has a fracture
an accident.
I completely do understand.
But I'm not getting that from the public hospitals. I'm not gonna lie, I've been on private hospitals since. And like maybe that's why I even thought I was born in a private hospital. My mom brought me down to earth. Shim, you were born at Kolebu.
Yeah.
And I said, no, that's not possible. She said, yes, you were born in Kolebu. And she's like, why do you think you were not born in Kolebu? And I said, because when I hear Kolebu, I associate it with...
Yeah.
She said, no.
That is where you were born.
That's where you were born. It's a good hospital.
Yeah,
you had good doctors. They took me through from pregnancy up until you came. And then when you were fine to be, referred because of the distance and whatnot, that's when we started the private clinic.
Private sector. Okay.
Let's talk about First Aid on Wheels. What pushed you for First Aid on Wheels?
First Aid on Wheels was born out of the need to create some level of health education and awareness to the general public. I have experienced certain emergent or urgent situations where most people around did not know what to do. So you're walking down the street and then maybe you collapse.
Right.
The next person or the person that is probably walking beside you or even a passerby does not know what to do in the event of that emergency. And so I believe that creating that awareness, educating people, educating the public on what to do in urgent situations is important. Because when it comes to healthcare, time is of the essence. And so long as you have life, the tendency of an emergency is inevitable.
Yeah.
There would always be an emergency. Whether it's you walking down the street, you can just be in your little bubble. But unless it's an ideal bubble, once you step out of that bubble, the chances of you
falling down,
getting knocked down by a car, anything can happen.
Inhaling smoke,
Exactly. And so, what is the attitude of people around you in the event of that emergency? Do they know what to do?
Right.
Something as little as calling for help can save a life, or simply not doing anything
can save a life. Yeah.
There's been incidents where a child has been brought into the clinic because he collapsed, and then now we are trying to aspirate palm oil from the child's throat. So it's a lot. You have these superstitious beliefs or these cultural beliefs where, pour water on them, put palm oil, do this, do that. So many things that would only cause more harm than it would good. So First Aid on Wheels is more about addressing this need and providing a solution for where people do not know what to do in the event of emergency.
I think it's coming out great.
Is that an ambulance?
That's your ambulance. Your ambulance is coming out great.
Nice.
I thought I was sucked at this, guys. I'm proud.
Mine is just colors.
But I think life is supposed to be colorful.
Yeah.
You can't be stressed out.
At all.
You're a doctor, fashion icon.
Hey. Fashion icon.
Have you people seen the olden days, how the doctors were dressing?
The stereotype.
No, this one was for the headmistresses, right? The doctor's one was up here, the stethoscope up there, quiet. Just every day, one way. Vanessa has lubes on, white jeans. Look at the watch. She's got acrylics on.
Oh my goodness.
Let's talk about your style. At what point did you realize that I'm not going to be wearing the white coating, with, thankfully you don't wear glasses, but
I'm a firm believer of making the best of the situation that you find yourself in. So as a medical doctor, yes, your life doesn't end by
because
being a
of your
medical doctor,
profession,
because of your profession, rightly. And so how can I blend the two? I don't have to lose myself into the profession. Little ways that I can add who I am into that profession is what I've been doing.
You're acing it too.
Well, thank you.
Hey, makeup on point, nails on fleek, hair on fleek.
Thank you.
Red lips.
Preserve the mental health.
Yeah, okay. You're an advocate yourself, like breast cancer, reproductive health. You're a health advocate, and mental health is something that you talk about like on a daily. So let's have that conversation. Where
did
are we?
Where advocacy come from?
Yes, and then where are we going to in terms of mental health awareness and advocacy?
Right. So for me, my advocacy journey, I would say, stems from lived experiences. And then from my own personal experiences and then other experiences like domestic violence, mental health related issues, healthcare. Now, with mental health, there is quite a lot of awareness on it. A whole lot of awareness on it. We're becoming more aware of what mental health is. Back in the day, if you're struggling with even anxiety, depression is perceived as something that should not be spoken about. It's shrouded in secrecy. It's spoken about in very hushed tones. And so people barely spoke about their struggles.
Yeah.
But now that there is some level of awareness and education, people are becoming self-aware that, okay, I'm struggling. But most people tend to downplay that, oh, you're feeling sick, you're feeling this, or every day you are down, every day you are this. But these are certain cues that we often miss. And so educating the public on mental health related illnesses and allows us to understand ourselves better and also offer some sort of support to persons that may be dealing with mental health related diseases. Yeah.
What's the future for mental health advocacy here in Ghana?
I would say mental health is significantly tied to productivity. So if you're looking at the entirety of health, when we talk about health, people are quick to think physical health.
Exactly.
But then, if your mental health is not at the right level, it impacts your physical health as well as your social interactions. And that also influences your productivity level. So in terms of mental health, for the future of mental health, especially in our setting, is employers are going to understand that the mental health of their employees is important just as much as their physical health is. And so they're going to put in a lot more resources into ensuring that the individuals who are working for them are to an extent stable, because you need that creativity. You need that level of normalcy or standard to be able to apply yourself in whatever it is that you do, whether it's in the workplace, it's at home, anywhere. You need to be of sound mind to be able to apply yourself effectively. So the future of mental health is absolutely looking bright, because now we are speaking about it a lot more, we're understanding it a lot more, and we're willing to provide the resources to ensure that our mental health is good.
Now, Vanessa can talk.
Hey, I can talk.
You people don't know, but before we started, Vanessa was giving me a whole rundown. You people remember she said she's a mother. So we're going to get into motherhood and mental health, because that's an area least explored. So since we're on the topic of mental health, let's shift it to motherhood and mental health. Vanessa's a mom of 2. One girl, one boy. They are all under the age of 8. So she's dealing with a lot.
I'm going through it.
How are you balancing all this? Plus your other commitments as well.
Well, it's not easy. I won't even lie. It's not easy at all. However, having the right support is what keeps me going. And my children remind me of why I need to work hard. I'm trying to provide for them the lifestyle or the kind of comfort that I deem fit. And also in terms of work, being a medical doctor is such, I'm looking for the right word, it's such a fulfilling and yet
draining,
challenging, field. My patients keep me going every day, because I know that I'm going into work to be of help to someone. When a person is unwell, they come in their most vulnerable states. They're absolutely vulnerable, and they're looking to you to provide some level of answers or some level of management for them. And when you're finished, the sort of feedback that you get gives you a reason to keep going. And then we're looking at the other impact that is being made. There are people that are probably looking up to you, and so you just have to keep going. But with the right support, it's absolutely achievable and doable.
Right support can be family and friends.
Absolutely.
I can't help but marvel at the friendship you have with Trudy. Like, you people look like sisters.
My mom says that.
Where did you find yourselves?
Where did we find ourselves? So, I think the first time Trudy met me, I think I was in a boxing gym or something.
What are you doing there? Vanessa.
This was sometime, I think 2017, 2018. Yes. But of course, we didn't speak. She thought I was stuck up. She thought I was this. She thought I was that. I'm like, yeah, okay.
A lot of people think fine girls are stuck up.
And it's okay.
That's all right.
Yeah, it's okay. It's okay. Those who know. Let me put it that way. And subsequently, she owns Studio 7.
Yeah.
Med
Spa.
Yes, Med Spa and then Clinic. Studio 7, Med Spa and Clinic. So before it became Studio 7, Med Spa and Clinic, I used to go there when it was a salon.
Yeah.
So go there to get my self-care, you know, hair, nails, massages, waxing.
It's all part of the style. It's not just fashion and clothes. It's style. Listen.
Yes. So self-care, getting all of those done.
Right.
So over time, we built a relationship. We started talking, and that's how we became friends.
You people are like this.
Yeah, we're close.
And it's in a world where feminine friendships don't last. You people have a sisterhood that seems to be defined.
We're thriving, eh?
Because you're each in different spaces, and yet you both come together for whoever's cause it's supposed to be.
Yeah.
She's been at your events, you've been at her events. You people troll yourselves across the internet. She's in London, you're in London, you meet up, you know.
Wow.
Yeah. The funny thing is, you've been on my Snap for the longest.
Is it?
She's been on my Snap for the longest.
Oh, so
it's like, I'm seeing you two people.
Yeah.
And when there's a new wig, you're trolling her that she better have your copy down. And when there's an event, she's trolling you that you better have her spots down for her.
Yeah.
So, how fulfilling is that friendship, or should I say sisterhood, to you both? Because you met at just like that.
Yeah.
It's a random something, and you didn't. It's not from childhood. It's random.
No.
2017, and it's thriving up until now, where your mom even sees you people as siblings.
Yes.
And I believe that you even see yourselves as siblings.
Yeah.
Like, how fulfilling is it to you, coming from an all-boys home, to having this one sister that you run to for help, you smile with, you laugh with, chill with, you know, share business advice with. How fulfilling is it for you?
Absolutely fulfilling. Friendship, having a good friendship is something that I wish on each and every woman. You get to a certain age where you just need someone that you can call on.
Yeah.
Someone that has your back just as much as you have theirs.
Yeah.
It's about understanding boundaries, standards, the vision for your life, for her life, and how you can collaborate to ensure that you're both successful. We're both mothers.
Exactly.
Yes. So
you've been sharing some motherhood tidbits here and
you
there.
know, navigating life as women, as mothers, as sisters. You know,
That's so nice.
It's absolutely fulfilling, and you'll be surprised that Trudy and I don't see ourselves every single day.
But you speak every single day.
Yeah, we actually don't even speak every single day.
You're lying.
Absolutely. And that's the beauty about friendship. It's about understanding that we each have our lives to live.
Yeah.
And so nobody is holding anybody to unnecessary standards where, I expect you to call me every day. I expect you to check up on me every day. I mean,
I think a lot of us have forgotten that there are certain aspects of friendships that as you grow, you need to adapt. That you don't need to call somebody every day, but you do need to check up from time to time.
Absolutely.
You need to be there when she's going through something.
Yes.
You should even be aware of it. And we're holding ourselves to unnecessary accountability, which shouldn't be so. How do you guys hold yourself accountable in your friendships?
By being open, by communicating. We're adults. There's no point in feeling embittered especially if I believe that she's done something to me that I'm not happy with.
Yeah.
I would communicate that, hey, I didn't like this. And then you get her perspective, and if there's a need to apologize,
There's an
it's
apology.
done, and vice versa. So it's about being open, communicating, because nobody can read your mind.
Yeah, that's true.
And as you get older, you understand the value of genuine friendship and sisterhood.
Guys, please pick your friends. Make sure that they're not just picking you, but you're choosing them.
Yeah.
And you're having conversations that need to be had, and not just sitting down gossiping. You can gossip, but make sure that 90% of your conversations are success-driven conversations. And just have fun in your friendships. Honestly, have fun in your friendships. You said Trudy met you in a boxing ring.
Oh, goodness.
You're a fitness enthusiast.
I'm not!
And I don't know. You cannot not be what are you doing in a boxing ring?
So,
is it self-defense or something?
Oh, I mean, as for the self-defense, every woman too, or every individual, it's a survival skill that I believe that every individual should pick up. However, how did I find myself at that boxing gym? So it was one of those things that you're going to the gym, and I happen to, it's also a boxing gym, so it's a gym that has a boxing aspect of it, and I just thought to try my hands on it. But if there's a boxing,
so you're gonna make use of it. Do you swim?
No, I don't swim.
So why don't you swim and you box?
How many times would I find myself in the water?
How many times did you find yourself
defending myself?
You're a woman. Gosh, did I set myself up? You're gonna find yourself in water 90% of the time because you've got kids under 10. They go to the swimming pool.
Oh, they do. They know how to swim.
And you cheer from the sidelines. That's fine. Ain't no shame in that.
Go. I'm that mommy.
How did you snap back into this? Because we haven't finished motherhood and depression. Motherhood and mental health. So let's dial it back there. How did you snatch back? Because you're beautiful. Guys, Kama is not doing her justice. You need to see her in person. She's beautiful.
Thank you.
She laughs in steeze and style and composure. I'm feeling left out. But how did you snap?
Thank you. I didn't do anything particularly unusual. Yes, so I would bring it down to genetics. And then I know it's annoying. But yeah. I'm not going to apologize for that.
Don't. Ain't no shame
at all. And I would say that the period of pregnancy for me was difficult.
Okay.
Where I was barely eating. So I had significant issues during the pregnancy.
Oh, you did it twice.
Yeah, I did it twice, of course. Yeah, I know. We say we won't do it again, but then here we are. 2 kids later.
Oh, yeah. That's understandable.
I'm not finished. Yeah.
How many are you planning to do? Hey!
Stop.
Vanessa!
Oh, be calming down. But so snapping back, I would pin it to genetics and the period of pregnancy where I couldn't really eat anything. So
there wasn't much storing.
Yes, much for me to lose. So yeah, there isn't anything special that I did. I need to put it out there because I've got quite a number of questions about that. What did you do? Did you wear a waist trainer? Did you take this tea? Did you do this? And yeah,
like this conversation is not hard enough. Postpartum depression, and even people don't even believe it exists.
Oh,
but yeah, because the African setting is in such a way that your mom or your family relatives are like with you when you give birth. When you come home, right? I don't know for some, but I know majority of the setting is in such a way that your folks, the woman, they're with you when you come home from the hospital. They spend a considerable amount of time with you. Like, for example, I grew up with both my parents, but I grew up with a lot of my cousins around, with my grandparents too around. Do you get it? So I know for a fact that if I should ask any of my family members if they ever went through that, they would say they don't know, or they're not even sure if they did, mainly because there was
that support.
Yeah, the family support. So I had uncles stepping in where daddy was unable
They
to
understood
send
that
me.
it takes a village to
Exactly.
raise a child.
Yes. And grandma was there
Yeah.
for when mommy had to go back to work.
Yeah.
My cousins were there when we needed babysitting. So the whole village was involved. So I know for a fact if I ask them, they will say they don't know. For my mother, I know for a fact that we have this conversation every day.
Yeah.
What is postpartum depression? When does it start? Does it even start after birth, or does it start before birth? And I've been telling that I've not been pregnant before. You have. If you haven't experienced it, this is what I know from the internet, that people are depressed after giving birth because of the hormonal changes during pregnancy. The thing is not sitting right up there after birth, because you have 9 months with a belly, and then
All of a sudden,
it's back to flesh, right? You're not wearing the same size anymore. You're not looking your best anymore. Your boobs are bigger than normal. Nipples are swollen, etc., etc. And then if you don't have a supportive partner as well, that just moves it from 0 to 100. If you're not a breastfeeding mom too, and you need to rely on formula, that's also something we need to think about. There's a lot going on in the pregnancy.
yeah.
So what's going on? Is it before birth or after birth?
I mean, just like the name rightly depicts, postpartum. So that is after delivery or after birth. So postpartum depression is simply being depressed after the delivery or after the process of pregnancy.
Right.
Now, I like how you said that if you ask the older generation if they ever went through it, they'll say they don't know. And rightly so, they do not know, because their generation understood the concept of it takes a village to raise a child. However, if you look at today's generation, we're more nuclear focused.
Right.
And majority of the women have either migrated with their spouses.
Okay.
So they're having no support
Okay.
at all, little to no support, and they're relying on external help.
Okay.
And we also have women, career women, that are giving birth. And we're looking at the maternity leave that is given.
3 months.
Yes.
Is that fair?
Maternity leave should last till your child is like 18. But yeah, that's a conversation for another day. But these are the sacrifices that women have to make, which shouldn't be the case. But then I believe that as time goes on, as time changes, we would see the problem and then provide sustainable solutions. So back with the older generation, they had their families. After giving birth, the woman goes to her side of the family where she stays with them for about 3 months, or as long as she feels the need to be there.
Right.
She has aunties cooking for her. All she has to do, I mean, my mom experienced that. I saw that with our youngest brother.
Okay.
You know, she was with my dad's sister.
Okay.
She raised us.
Okay.
She was with my dad's sister. All she had to do, technically, or what the older generation had to do, was wake up and simply breastfeed. Food was provided for you. Your environment was taken care of. So all you had to do was simply.
So you were basically the bigger baby.
Exactly. All you had to do, they provided you with the best of meals, because they believe that the child, your milk has to flow.
Yeah.
Your milk has to flow so that it can feed, you can feed the child.
Yeah.
But now things have changed drastically. There is this nuclear idea, or this nuclear formation, where it's just women, their spouses, and then there are also the pressures from society of trying to go back to work, individual expectations, that missing out that my body is not how it used to be, trying to come to terms with the fact that this is a new phase.
Exactly.
And then you have a child that is constantly feeding, crying, pooping, wailing. You're feeding around the clock every 2 hours. So there's the lack of sleep. If there is not enough support from your spouse, that expectation of yourself and the pressure to even return to work and be productive. So that can tilt a lot of women into postpartum depression and the hormonal fluctuations.
Yeah.
1 minute you have these sets of hormones, the next minute everything is just trying to go back into normal, you know. So it's a lot that is going on
on
with
a heart
the individual.
machine.
Yes. So postpartum depression is a real thing, and I don't want people to take it lightly, because if we keep taking it lightly, or we keep thinking that, oh, maybe she just wants to be spoiled, she just wants to be pampered, she just wants to be princessy,
But there's nothing
then we're
wrong
not.
with that.
There's absolutely nothing wrong with that. But if we think in that direction, then it makes it difficult for us to provide solutions to the mothers who need it. Every single woman that has gone through pregnancy, delivery, postpartum needs a certain level of support, and we as a community, whether it's in the house, it's in the home, or it's at the workplace, in our churches, we all need to come together to give her the right support, just so that she's in the right frame of mind. Because if mother is okay, baby will definitely be okay.
This is going to air in October. And October is breast cancer awareness. For future.
For future reference, eh?
You're going to have girl children. I don't believe you need to be left out of these conversations. For those of you who have wives and girlfriends and fiancés and baby mamas and whatnot, mothers and grannies, breast cancer is like, it's not for a certain group of people. So long as you've got boobs, you are exposed. And I brought you a doctor for this. So she's got the floor, and I'm gonna sip some tea while I listen to her tea.
Well, first, I would want to demystify what you said about breast cancer being mainly women focused.
Oh,
Yes. It's not just women that are at risk
men
of breast
too?
cancer. Women are at highest risk of breast cancer.
Okay.
However, men can get breast cancer.
From what?
To me, from what? They have breast tissue, do they not?
They do. Why are you looking at me like I just took something from you? They do.
So, what is breast cancer? Breast cancer is simply abnormal growth of breast cells.
Yes,
So, men have breast cells.
they do.
Yes, they do. They do. And let me even, so breast cancer is not just about the breast. We're looking at
Okay.
the nipple and areola regions.
Okay.
Men have nipple and areola.
Okay. They
So-
just don't have the protrusions.
They don't have as much tissue as we women do.
Okay.
So breast cancer awareness is important. Women, that is the second leading cause of cancer deaths among women globally.
okay.
And early detection saves lives. That's why October is dedicated for breast cancer awareness. But the awareness should go beyond October.
Okay.
The reason being that we should constantly engage our health professionals. We should constantly engage our bodies, understand our bodies, and not just limit it to October. But October is where we make a lot of noise so that we remind women and men alike that there is something called breast cancer. And early detection saves lives, meaning that when it's detected early, your prognosis is very good. So you don't have to sit and wait until things become bad before you go running.
Right.
So being familiar with your body, knowing when there's any change at any point so that you can pick it up quickly and quickly get it assessed so that it doesn't progress into the stage 4 breast cancer. Because the treatment of breast cancer is highly dependent on the type as well as the staging.
Okay.
So the earlier it is detected,
the
the
better.
better your chances of survival.
So you'd still go through the same chemo.
Yes. So once the diagnosis of breast cancer is made, once the type is known as well as the staging of the breast cancer is known, there is different management modalities. So first is surgical, where there's a need to remove the tumor. So after the tumor is removed, then the options of radiotherapy and chemotherapy, and then hormonal replacement therapy is given. So it's a combined treatment
plan,
that,
like,
exactly.
you know,
so it's not just about removing the tumor
tissue.
and then it ends there, because once you've been diagnosed with breast cancer,
there's always a
chance
regression.
Exactly. So the chemotherapy, the radiotherapy is done to target the cancer cells, which may have been left after the surgery, and then the chemotherapy is more like an IV that is given to help target even more the cancer cells.
So with all this, collective treatment, do we provide psychological help
it's
to them?
all supposed to be part. It's a holistic treatment plan.
Because it can be easy, waking up, finding a lump, even
going and being told that
you've got cancer.
Yes. So treatment is not just about taking it out, going for chemo. There's that. There's also the psychological aspect, because the mind is a very powerful tool, and you need to build some sort of mental resilience to navigate the challenges of life. And bringing that into breast cancer, providing emotional support, psychological support is essential for the overall treatment of the individual, because it all starts from the mind.
Yeah.
If you feel defeated in the mind, it's going to move in the physical.
Yeah.
Yes. So providing emotional support, psychological support is very important. It's offered when you go to the oncology units at the different facilities. They provide psychological support for patients who are going through certain terminal illnesses.
Psychological support in general, like walking into any unit and asking for therapy, how important is that?
Very, very important. We downplay mental health. We absolutely downplay mental health. It's a very thin line from health and then having a mental health crisis or a mental health emergency. And it's a build-up of things. You'll be going through life, having all the difficulties. You'll be bracing it up, until one day, the saying of the last straw that hit the camel's back. Then it's like, where did all of this come from? But then this person was showing signs,
and we were
ignoring it. We were not paying close attention to these cues. Hopelessness, person saying, oh, I wish all of this could end, neglecting their own well-being, little things that we need to pick up on, how people relate with others. You see someone who, like, sudden change in behaviors. These are certain things that should allow you to pause and then ask the person, is everything okay? How are you feeling today? These kinds of things allow you. Look at you, about to cry on me. And I haven't even started.
The doctor has just moved me from 100 to 0. I've been asking people, how are you? How are you? How are you? You are not minding me.
Yeah,
the doctor said, I should now be asking you, how are you? So if I ask you, how are you, and you don't mind me, we have a problem.
And you also need to ask yourself these questions. What are you doing that puts you at risk of mental ill health? Are there things that you feel that might quickly tilt you into the other side? What are you doing differently? How are you protecting your mental health? Are you overly on social media? What are you absorbing? What are you putting into your system? Even the foods that you eat, lack of sleep, that pushes your mental health, or it puts your mental health at risk. When I say I'm a feminist, what I'm saying is I have a male child and I have a female child.
Yeah.
I want to be sure that my daughter has the same opportunities as her brother, and she is not limited by virtue of the fact that she's a girl. That's it.
We're gonna end the conversation here. She's gonna come on as a repeat guest. Thanks, owing to the fact that she's a Hobson, and this has been such a warm conversation. We've actually lost track of time.
Look,
we're not even shy to admit that we have lost track of time. And yeah, thank you for sticking with us throughout this episode. Vanessa's going to sip her tea when the cameras are down. She's having steez like that, so she's going to sip her tea when the cameras are down. But in the meantime, please don't forget to subscribe, share, and like our video. Share with anybody, repost, do whatever you need to do. Push this video out. We'll see you in the next episode. This is Breaking Barriers, your platform for the youth, young entrepreneurs, and entrepreneurs for changing the narrative for themselves, their family, and their community. I'll see you next week. Bye.